episode of Voices of Inclusive Research podcast. I'm your host, Dr. Rand, and today you will only hear my voice. There's no guest today, and that is intentional. I want to begin this episode by naming something clearly and honestly. I paused my regular scheduled episode because continuing with business as usual did not feel honest or ethical. As a leader of a community-based organization, I speak with community members often. And right now, many of those conversations are filled with fear, grief, confusion, and exhaustion. There is violence, there is unrest, and there is a growing sense that humanity itself feels under attack. I spend a lot of my time asking communities to listen to me. I ask them to listen when I talk about research. I ask them to listen when I explain why research matters. I ask them to trust me when I say that research can be valuable, protective, and even life changing. And when you ask people to listen to you and trust you, you inherit responsibility. I often say in my everyday work that there is absolutely no way we can ignore real lived experiences in the community. I say that constantly. It is core to how I speak, it is core to how I lead. So if I am staying true to that belief, then I cannot ignore what is happening right now. I cannot continue talking about research as if nothing else is going on, especially when the unrest we are seeing, particularly in Minneapolis, directly affects the very communities that I serve. If I don't address the moment, then how can I ask the community to hear anything else I have to say? How can I ask for trust while pretending that this isn't happening? The mission of my organization is rooted in equity. Equity means safety. Equity means dignity. Equity means being able to exist without fear. Violence, unrest, fear, and instability have no place in our mission, but they are very present in the realities our communities are living in today. And if that is what our communities are facing, then I have to address it before I can continue to talk about research, studies, or participation. Reality is, fear changes everything. In research and healthcare, we often talk about trust as if it's theoretical. But trust is built or broken in real moments. Trust is built when a mother feels safe by taking her child to the doctor, but it's broken when a patient hesitates to seek care because they fear being questioned, reported, treated, or treated as suspicious. Trust is built when people are seen as humans, but it is broken when systems prioritize control, timelines, or efficiency over dignity. Every day, our work asks communities to trust systems, the healthcare system, the research process, institutions that historically have not always protected or respected them. We ask people to participate, to share their data, to show up to appointments, to enroll in studies, to believe that their lives and voices matter. But trust cannot be conditional, and trust cannot exist when fear defines daily life. Unrest doesn't only show up in the news, it shows up when a patient cancels an appointment they waited months for. It shows up when enrollment drops, not because people don't care about research, but because survival comes first. It shows up when community advocates tell us people are afraid to leave their homes right now. I have heard that directly. And when that is the reality, we have to ask ourselves some uncomfortable questions. How do we expect people to prioritize health? How do we expect ethical participation in research? How do we claim progress while ignoring the conditions people are living under? Fear disrupts care. Fear reshapes decisions making. Fear erodes trust. Fear is a social determinant of health. This is where the conversation gets uncomfortable, but it is necessary. We often talk about systems as if they are neutral, as if harm is accidental, as if no one is responsible. But systems are designed, they're maintained, and they benefit some people more than others. When systems produce fear, violence, and exclusion, and we continue to operate as if nothing is happening, that is not neutrality. That is complicity. I'm not saying every person within these systems is harmful, but I'm saying we must be honest when systems fail to protect humanity. And we must be willing to ask, what are we protecting? Who is paying the cost? And why does silence feel safer than speaking? I want to speak directly to my colleagues in research, healthcare, and pharma. It's easy to think that change only happens at the federal level, but science does not start there. We know that science starts in the labs, in research questions, in grant proposals, in study designs, in RB meetings, and conversations about feasibility and risk, which means we shape what is considered ethical. We decide whether community fear is outside the scope or central to our work. We decide whether timelines matter more than people. We decide whether silence is acceptable. And that means we are not powerless. If I tell communities that their lived experiences matter, then I cannot ignore those experiences when communities are grieving, fearful, or under attack. If I ask people to trust systems, then those systems must be worthy of that trust. Silence in moments like this is not neutral. Silence communicates priorities. And right now, humanity must be the priority. I don't want to end this episode in despair. I want to end with responsibility and hope. Hope doesn't mean pretending everything is fine. Hope means believing we can do better and choosing to act. Change does not begin with policy, it begins with people. Health equity cannot exist in a climate of fear. Let me say that again. Health equity cannot exist in a climate of fear, but humanity can still be centered if we choose it. Thank you so much for listening today. Thank you for reflecting. And most importantly, thank you for being willing to act.